Hello friends, and a very warm welcome to your dedicated health channel. Today, we're going to talk about a condition that affects millions of people across the globe, diabetes mellitus, which many of us simply call the sugar disease. Now let me share some eye-opening numbers with you. Did you know that in Saudi Arabia, more than 23% of adults are living with diabetes? That's almost 1 in every 4 people. The situation in Pakistan is even more serious, with a prevalence rate of around 31.4%, which is the highest in the world, affecting over 34 million adults. Every year, this disease leads to millions suffering from devastating complications like heart attacks, kidney failure, blindness, and even amputations. But here's the most important thing I want you to take away today. This is not a message of fear, but a message of hope. The best news is that diabetes is absolutely manageable. With early understanding and the right actions, you can live a completely normal, healthy, and fulfilling life. In this detailed video, we're going to cover everything you need to know. We'll explore what diabetes is, its different types, the causes and risk factors, its common symptoms, how it's diagnosed, the various treatment options, potential complications, and most importantly, how to prevent it and manage it day to day. So please, watch until the very end and share this vital information with your family and friends. Let's get started on this journey to better health together. So, what exactly is diabetes? To understand that, let's first talk about how our bodies work. Our body's main source of fuel is a type of sugar called glucose, which we get from the food we eat. When we consume carbohydrates, things like bread, rice, potatoes, or sweets, our digestive system breaks them down into glucose. This glucose then enters our bloodstream. Now, for this glucose to be used as energy by our cells, we need a special key. This key is a hormone called insulin. Insulin is produced by an organ called the pancreas, and its job is to unlock our body's cells, allowing glucose to enter and provide energy. Diabetes occurs when this process goes wrong. There are 2 main ways this can happen. Either the pancreas stops producing enough insulin, or in some cases, it produces no insulin at all. The other possibility is that the body can't use the insulin it produces effectively. This is a condition known as insulin resistance. What's the result? The glucose can't get into the cells, so it gets stuck in the bloodstream. This leads to high levels of sugar in the blood, a condition called hyperglycemia. Over time, these consistently high blood sugar levels can cause serious damage to various organs and tissues throughout the body, like your eyes, kidneys, nerves, and heart. Diabetes is a chronic condition, which means it's long-lasting and requires lifelong management. But don't let that discourage you. Especially in the early stages like prediabetes or early type 2 diabetes, making positive lifestyle changes can sometimes even reverse the condition or prevent it from progressing. Now let's talk about the different types of diabetes. While there are several forms, there are 3 main types that we hear about most often. First, we have type 1 diabetes. This accounts for about 5 to 10% of all diabetes cases. In type 1, the body's own immune system makes a mistake. It attacks and destroys the insulin-producing cells, called beta cells, in the pancreas. As a result, the body produces very little or no insulin at all. This type of diabetes often develops in children, teenagers, or young adults, usually under the age of 30, and its onset can be quite sudden. For people with type 1 diabetes, taking insulin every day, either through injections or an insulin pump, is essential for survival. Next, we have type 2 diabetes, which is by far the most common, making up 90 to 95% of all cases. This is the type that has become a major health issue in countries like Saudi Arabia and Pakistan. In type 2 diabetes, the body either doesn't use insulin properly, that's the insulin resistance we talked about, or the pancreas can't produce enough insulin to keep up with the body's needs. It usually develops in adults over the age of 40, but we are seeing it more and more in younger people too. It's strongly linked to factors like obesity, a sedentary lifestyle, and a family history of the disease. The third main type is gestational diabetes. This type develops in some women during pregnancy. Hormones produced by the placenta can block the action of insulin, leading to high blood sugar levels. While it usually goes away after the baby is born, it does pose risks to both the mother and the baby during pregnancy. It also significantly increases the mother's risk of developing type 2 diabetes later in life. Beyond these three, there are other, less common types. For instance, prediabetes is a crucial warning stage where blood sugar levels are higher than normal, but not yet high enough to be diagnosed as type 2 diabetes. Think of it as a yellow traffic light, a signal to take action now. There are also genetic forms like MODY, which stands for maturity onset diabetes of the young, and even neonatal diabetes, which occurs in the first few months of life. Understanding the type of diabetes is critical because it determines the best course of management and treatment. So, what causes these different types of diabetes, and who is at risk? Let's break it down. For type 1 diabetes, the exact cause is still not fully understood, but it's believed to be a combination of genetic predisposition and environmental triggers. This means a person might have genes that make them more susceptible, and then a trigger, like a viral infection, could set off the autoimmune attack on the pancreas. Because of this, type 1 diabetes is not considered preventable with our current knowledge. Now, for type 2 diabetes, the story is very different. This type is largely preventable, and its causes are closely tied to lifestyle and genetics. A major risk factor is being overweight or obese, especially having excess fat around the abdomen. A sedentary lifestyle, with little to no physical activity, also significantly increases your risk. Your diet plays a huge role. A diet high in processed foods, sugary drinks, and unhealthy fats contributes directly to insulin resistance and weight gain. Family history is another important factor. If your parents or siblings have type 2 diabetes, your risk is higher. Age is also a factor, as the risk increases as we get older, particularly after age 45. Certain ethnicities, including people of South Asian, Middle Eastern, and African descent, have a genetically higher risk. Conditions like high blood pressure, high cholesterol, and polycystic ovary syndrome also increase the likelihood of developing type 2 diabetes. This is why the high rates in places like Saudi Arabia and Pakistan are so alarming. They reflect widespread changes in diet and activity levels. The good news is that these are risk factors we can change. By managing our weight, eating a healthy diet, and staying physically active, we can dramatically reduce our risk of developing type 2 diabetes. For gestational diabetes, the risk factors are similar to type 2. Being overweight before pregnancy, having a family history of diabetes, being older, or having had gestational diabetes in a previous pregnancy all increase the risk. Recognizing the symptoms of diabetes early is key to getting a timely diagnosis and starting management. The symptoms can be subtle at first, especially for type 2 diabetes, which is why many people don't realize they have it for years. The classic symptoms are caused by high blood sugar and the body's attempt to deal with it. One of the most common signs is frequent urination. When there's excess sugar in your blood, your kidneys work overtime to filter and absorb it. When they can't keep up, the excess sugar is excreted into your urine, dragging fluids from your tissues, which makes you have to go to the bathroom more often, especially at night. This leads to another key symptom: increased thirst. The frequent urination can leave you dehydrated, making you feel constantly thirsty. You might also experience unexplained weight loss. This happens because without enough insulin, your body can't use the glucose from food for energy. So, it starts burning fat and muscle for fuel instead, causing you to lose weight, even if you're eating normally or even more than usual. Speaking of which, increased hunger is another sign. Since your cells aren't getting the glucose they need for energy, your body thinks it's starving and sends signals that make you feel very hungry. Other common symptoms include persistent fatigue and weakness because your body isn't getting the fuel it needs. You might also experience blurred vision, as high blood sugar levels can pull fluid from the lenses of your eyes, affecting your ability to focus. Sores or cuts that heal slowly are another red flag, as high blood sugar can affect your circulation and nerve function, impairing the body's natural healing process. You might also get frequent infections, such as gum, skin, or vaginal infections. Some people also experience tingling, pain, or numbness in their hands or feet, which is a sign of nerve damage called neuropathy. It's important to remember that in type 1 diabetes, these symptoms can appear very suddenly and be severe. In type 2, they often develop slowly over several years and can be so mild that they go unnoticed. If you are experiencing any of these symptoms, please don't ignore them. It's crucial to see a doctor and get checked. Thank you so much for watching and for taking this step towards understanding your health better. Remember, knowledge is the first step to empowerment. If you found this information helpful, please give this video a thumbs up, subscribe to our channel for more health content, and don't forget to share it with your loved ones. Whether you've been recently diagnosed, are at risk, or just want to understand it better, this guide is for you. We'll cover what it is, its causes, symptoms, and most importantly, how to manage and even prevent it through positive lifestyle changes. So, what exactly is type 2 diabetes? It is a chronic condition where your body either does not produce enough insulin or resists the insulin it does produce. Insulin is a hormone that acts like a key, letting blood sugar into your cells for energy. When this process doesn't work right, sugar builds up in your bloodstream, which can lead to serious health problems over time. Unlike type 1 diabetes, which is an autoimmune disease, type 2 is largely influenced by lifestyle factors and genetics, and it usually develops over many years. Let's dive into the causes. There isn't a single cause, but a combination of factors. Genetics play a significant role. If you have a close family member with type 2 diabetes, your risk is higher. Age is another factor. Your risk increases as you get older, especially after 45. However, the biggest contributors are lifestyle-related. Being overweight or obese, particularly with extra weight around your abdomen, dramatically increases your risk. A sedentary lifestyle with little to no physical activity also plays a huge part. In some regions, cultural and dietary habits can increase this risk. For instance, in places like Saudi Arabia and Pakistan, traditional diets can be rich in carbohydrates and fats. Dishes like biryani, kabsa, and sugary sweets, while delicious, can contribute to weight gain if consumed frequently. Combined with a modern, more sedentary lifestyle, this has led to a significant rise in type 2 diabetes in these regions. It's not about blaming culture, but about understanding how our habits impact our health so we can make informed choices. Now, how do you know if you might have type 2 diabetes? The symptoms can be subtle and develop slowly, so it's easy to miss them. You might feel constantly thirsty or need to urinate more often. Unexplained weight loss despite eating more can be a sign. Feeling tired and fatigued all the time is another common symptom. You might also experience blurred vision, slow healing sores, or frequent infections. Some people, especially men, might notice issues in their private life. It's crucial to listen to your body. If you notice any of these signs, don't ignore them. Getting diagnosed is a straightforward process. Your doctor will likely order a few blood tests. The A1C test measures your average blood sugar level over the past 2 to 3 months. A fasting plasma glucose test measures your blood sugar after you haven't eaten overnight. And an oral glucose tolerance test checks your blood sugar levels before and 2 hours after you drink a special sweet drink. These tests are simple, quick, and can give you a clear picture of what's happening inside your body. Early diagnosis is absolutely key to preventing complications. So, you've been diagnosed. What now? This is where the empowering part begins. Managing type 2 diabetes is very much in your hands. The cornerstone of treatment is lifestyle management. This means focusing on a healthy diet and regular physical activity. Your goal is to eat a balanced diet. Think lean proteins, lots of non-starchy vegetables, whole grains, and healthy fats. Portion control is essential. You don't have to give up your favorite foods entirely, but moderation is key. For example, instead of a large plate of rice with your curry, try swapping half the rice for a fresh salad or steamed vegetables. Let's talk about diet in the context of Saudi Arabia and Pakistan again. You can still enjoy traditional foods, Choose grilled meats like chicken or fish tikka over fried options. When making curries, use less oil and more vegetables. Swap sugary drinks and juices, which are very common, for water, green tea, or unsweetened laban. Dates are a staple, especially during Ramadan, and while they have health benefits, they are high in sugar, so enjoy them in moderation. Small, mindful changes can make a massive difference without sacrificing your cultural identity. Next up is physical activity. Aim for at least 150 minutes of moderate intensity exercise per week. That's just 30 minutes, 5 days a week. This could be anything from a brisk walk or a bike ride to swimming or dancing. Find something you enjoy so you'll stick with it. In hotter climates, it's a great idea to exercise in the early morning or evening, or even indoors at a gym or at home. The goal is to get your heart rate up and get moving. Regular exercise helps your body use insulin more effectively and is fantastic for your overall health. Beyond diet and exercise, your doctor might prescribe medication. Some people might need pills like metformin to help lower blood glucose levels. Others might need insulin injections. This isn't a sign of failure, it's just another tool to help you manage your condition effectively. It's vital to take your medication as prescribed and stay in regular contact with your healthcare team. They are your partners in this journey. Monitoring your blood sugar at home is also crucial. It helps you see how food, exercise, and medication affect your levels, empowering you to make real-time adjustments. Now we need to discuss complications. If left unmanaged, high blood sugar can damage your body over time. It can lead to heart disease, stroke, kidney disease, nerve damage, neuropathy, and even vision problems that could lead to blindness. This might sound scary, but remember, these are preventable. By actively managing your blood sugar levels, you can significantly reduce your risk of developing these complications and live a long, healthy life. This is your motivation to stay on track. Prevention is always better than cure. If you're at risk for type 2 diabetes, the steps to prevent it are the same as the steps to manage it. Eat a healthy diet, get regular exercise, and maintain a healthy weight. Even losing a small amount of weight, just 5 to 7% of your body weight, can make a huge difference. If you're struggling, don't be afraid to seek help. Talk to your doctor, a dietitian, or a certified diabetes educator. There are support groups and resources available. Remember, asking for help is a sign of strength. Living with type 2 diabetes is a marathon, not a sprint. There will be good days and bad days. The key is to be consistent, not perfect. Celebrate your small victories. Be kind to yourself when you slip up, and get right back on track. Your journey is unique to you. Find what works for you. Build a strong support system, and stay positive. You have the power to control this condition and live a full, vibrant life. Thank you so much for watching. I hope this guide was helpful and empowering. If you have any questions, please leave them in the comments below. And if you found this video valuable, please give it a thumbs up and subscribe to the channel for more health content. Stay healthy, stay positive, and we'll see you in the next video.